being a therapist is being a provider of a unique kind of space for people. I'm providing two things to people that they don't get anywhere else, which would be confidentiality and, sounds weird to say, but expert feedback. Those things aren't guaranteed in any other setting, so as a therapist I feel like it's pretty unique to be able to provide that to my clients. Being a psychology student at Morehouse in Atlanta was important for me. You know, I was educated by accomplished psychologists and mental health professionals that, you know, mostly all of them were Black. So to see a career path in that way was great. Then in my MSW program at Howard in DC, we learned to have, one of the biggest takeaways was having a strengths-based perspective. So I'm grateful that I went to the schools that I went to.
Did anyone inspire you?
Yeah, the first person who comes to mind was my high school AP psychology teacher. It was a class that everybody tried to get into with limited spots, so he really made psychology an interesting kind of field. Also as a person, you know, people told me that I'm a good listener, and so sometimes I'd have like random moments when I was young, like on the subway in DC, and like people would like sit next to me and talk to me. So like taking those kind of moments plus my psychology kind of inspiration in high school led me to study psychology in undergrad and see a space for myself in mental health. There's a uniqueness to the Black experience in America, and that has always had an impact on our mental health collectively and individually. Also, if you look at the history of the social work profession, I'm a social worker, and the history of like mental health in general, real damage was done to Black people. So being a part of kind of reclaiming those professions is important to me. Address the stigma about mental health services in the Black community is important to me. In the mental health space, in the therapeutic space, race and culture and identity are important. So clients don't have to like translate things or bridge any gaps. I'm in a unique position to provide something for people who typically don't receive it. Representation does matter. It would make sense that Black people want a Black therapist, queer people want a queer therapist, etc. So I'm filling that need that otherwise was unmet.